Hi, I'm Bruce Hamilton. I want to welcome you to our live webcast with Dr. Arun Gulani, a world-renowned eye surgeon, and he's here to answer your questions about LASIK surgery. Dr. Gulani, good to have you here on MrJax.com with us.
A pleasure.
Let's start with establishing your credentials so people know where you're coming from. What's your background, what's your education, and what is it you like to bring to the patient experience most?
Very important to me, Bruce, is to design the surgery to each patient and their eyes. The whole concept being that you don't go and do only one or two surgeries and then make every patient fit into that mold. You in fact look at their eyes, look at their optical system, see what their profession is, what they expect in their vision, and then design the surgery accordingly. So when you can do these concepts of what I call vision corrective surgeries, LASIK is just one among them. And then you have laser vision surgeries, and then you have vision corrective surgeries. So there are so many permutations, combinations that each and everybody can have individualized, customized surgery for their eyes.
So what I'm hearing from you is that there's no general recipe, that everybody has an individual need. So let's start with some of the basics. Who is a candidate for LASIK surgery?
The four most important refractive errors which people buy glasses and contacts for are nearsightedness, farsightedness, and astigmatism, and presbyopia, which is after 40. So if you stick to the first three, many patients have these problems for which they're wearing contacts and glasses, and they'd be good candidates provided their cornea is healthy and the rest of their eye has no diseases. So because LASIK is done on the front part of your eye, the viewfinder or the cornea.
Well, you know what? Actually, let's go ahead and show people here. You have a model of the eye.
Absolutely.
Let's bring this into the fold so people can see what you're talking about.
So if you look at this eye here, you can see that the eye is basically like a camera. And here's your cornea, or the front part of the eye, which is where LASIK works, and it shapes this cornea so you can see. Then you have the lens over here, which is crystal clear when you're young, and with over time becomes blurry or cloudy and becomes a cataract. And of course the vision then transfers from the optic nerve to the brain. The brain is the main CPU or the computer that sees. So if you can manipulate the shape of this cornea, like in nearsighted people, you have to flatten the cornea. Far-sighted people, you have to steepen it. And in astigmatism cases where they have a football-shaped cornea, you make it spherical like a basketball. That's what the laser achieves.
Okay, let me stop you right there, because
yes.
People are sitting there and they're hearing, you have to manipulate the cornea. You have to do this to the cornea. Is it painful? Does it involve cutting? Is it invasive?
There are types of LASIK surgeries. Again, LASIK is one, but LASIK is one among about 18 laser vision techniques. All of these do one simple thing. The laser is pretty much a sculpting tool which is invisible, highly accurate. It can cut a pulse at every micron. And it is very, very precise and not painful. It's a cold laser, 193 nanometers. So think of the laser as a sculpting tool. It basically shapes this cornea, which we have numbed with drops, and it shapes it up in microns, literally through a process called photoablation, meaning the molecules are broken apart and the cornea is shaped within minutes, and you see.
All right, so I come in at 9 o'clock in the morning, and I'm prepped for the procedure. After, of course, I've had my consultation. What time can I go home? Do I have to stay overnight?
With me, it's slightly different, because I'm very, very, very picky. I will test you again before surgery. I will see you again after surgery, so it's a total of 1 hour. The surgery itself is minutes. So your surgery is done practically 3.5 minutes per eye, and you'll be seeing within an hour. And you're all set.
I'm home for lunch is what you're telling me.
Absolutely.
Okay. We talked about who is a candidate for LASIK surgery. Who is not?
Again, if you go by the concept that I described, that it's vision corrective surgery, there's a very big misnomer right now in the country and the world, because many doctors do, let's say, only LASIK or only cataract, only one surgery. Then it becomes you're not a candidate, which is incorrect. If you do the whole spectrum of surgeries, they may not be a candidate for LASIK, but they may be a candidate for phakic implants, ICLs, putting a permanent contact lens into the eye. They may be a candidate for lens exchange surgery. So in particular, a person is not a LASIK candidate if their cornea is very thin, or if they have some pathology in the cornea, and of course any inherent disease in the eye.
How about age requirements? I know that when you're a child, your eyes are changing. Now I have an 18-year-old, and he goes to the eye doctor, and I find out that he needs a new prescription because the shape of his eyes are changing, his vision ability is changing. Mm-hmm. Is there a point where you say, okay, my youngster is a candidate, or is there a point where you go, maybe you're a little bit too old for LASIK or one of the other surgeries?
Sure. The lowermost age you go for is at least 19, but there's something more important I'd like to say. Not only is the age important, you should have proof that that patient has not changed in their refraction over the last 2 years. And you can get records from your optometrist and check that. So that's very vital. It's just like, is this guy growing any more taller? Can I stitch him the final suit? So it's very important there. Once we have that criteria and they're over 19 and healthy, they're a candidate. 2, You asked about the upper age limit. If you recollect, we've done a morning show where I did LASIK on a 90-year-old gentleman who's now 20 playing golf. So I don't think there's an upper limit, again, as long as they're healthy and we are using the right technique for the right eye.
Okay. When people come into your office as a patient, you have a battery of questions that you ask them. I'm the patient walking in, and I'm interviewing a couple of doctors to decide where I want to go. What are the questions I should be asking you?
Most important thing is, like I said, is first of all, you should meet the surgeon. There is no substitute for that. Meet the surgeon and ask the questions that are worrying you. There is nothing like a silly question or, gosh, is this an important question? Number two is ask for doctor, step one, doctor, what procedure should I have in my best interest? I don't want to know what is the one or two things that you do. I want to know what's the best for me. Second level question, if that's the procedure, then what technology do you think is best for me? And third level question is there anything better out there that I should wait for? I think these three questions sum up my 9 questions that I give to patients to ask their surgeons. And of course, always ask, if something can go wrong, doctor, what's our backup plan? And those are vital questions according to me.
What types of complications? Do I need somebody there at the office with me before and after the surgery? Things like that. Some very good pointers there. All right. We've covered the questions that you should be asking. We've talked about who is responsible, who is a candidate and who is not a candidate for this type of surgery. Let's talk about some pure economics right now. I mean, everybody's got a tight budget. And insurance, in many cases, does not cover the surgery. We know that. But when you factor in the cost of eyeglasses, changing prescriptions, if you wear contacts, having to get a new case of contacts every 30 days, what's the cost balance here?
Actually, there was a study done on this that a lifetime of contact lens is much more expensive than a LASIK procedure. Number two is the patient's lifestyle. I mean, just people who are over -3 nearsighted or over +3 farsighted, they are literally, this is like a crutch for them, the glasses or contacts. They get up in the morning, the world doesn't exist until they put on their glasses to even see their loved ones or kids running up to their bed. So when you look at things from that aspect, which is what I've studied, you realize what an impact this has on vision. That's when you look at the investment, of course, it's a cost. But that cost is an investment in your own lifestyle. I mean, Bruce, what sense would you opt for if you were given to superlate that? Wouldn't that be vision?
Exactly.
And in the vision, you'll see again today, we have one of the patients here, but I'm even saying we should aim for better than 20/20 vision, so that itself is high def.
And we're going to be talking to a couple of your patients. We asked you to write in some questions for Dr. Gulani at AskDrGulani at WJXT.com. Let me go ahead and fire off one of the first questions from our viewers. This is from Rebecca in Jacksonville Beach. And Rebecca's question is, I had LASIK when I was a teenager, and I've had trouble since. I'm 26 now and need to wear glasses. My question is, can I get a new round of LASIK to fix my vision problems? And this plays directly to something that I've done a story with you on, and it's called turning back the clock.
Yes. Any refractive surgery, LASIK included, can be further corrected into the 21st century of vision. And here's the first few questions. I like to take everything logically, Bruce. You know me. I have so many second referrals and patients who email and call me, and they keep sending me information which is like, this test was done, this was done. I like to ask and get back to basics. So the reason you're not seeing now, is it because you were undercorrected to begin with? Number one. Number two, are you having what is called regression? Your doctor did a great job, but your body's kind of reshaping your cornea. And number three, are you having changes of age which are unrelated to the surgery? So if you look at it that way, now your system is very clear. If it's previously undercorrected, you got to go in and tweak it and correct it to today's vision. If it's something that your body has recurred or regressed, you correct that by lifting the flap or working on the flap. And if it's an age-related thing, let's say you're getting an early cataract and you're getting halos and getting nearsighted, go in and remove the cataract and correct that with the laser on the LASIK later. Similarly, people who had previous RKs, same thing. You can correct them based on their presentation.
And because you understand these realities, you're not just somebody who treats patients, you're actually an innovator and an inventor.
It's a passion, Bruce.
Let's talk about a couple of things that you've brought to the table that have changed the world of LASIK and vision correction.
Well, like I said, to me, I'm indebted to all my patients, their confidence, and that's what fuels my endeavor. I believe vision beyond 2020 is possible, with numerous of our patients seeing better than 2020, 2015, even 2010, and one of them's here today. I think the future is when people will walk into a doctor's office, and I've said this in print, a patient will walk into a doctor's office and say, "Doctor, I have 20/20 vision." And the doctor will stand up with a solemn look on his face and say, "Maybe I can help you."